Hello and welcome to the section on types of shock. We've already studied in the pathophysiology of perfusion the triangle of perfusion, which has the three components. The first one is the content, which is the blood. Second one is pump, which they're talking about the heart. And the third one is the pipes, which they're talking about the blood vessels. We're going to put these three components into an everyday example that we come across for ease of understanding. We're going to try and fill this bottle of water from the tap. The tap which is connected to the pipes, of course, the pipes which are running from the main tank connected with the pump. So we have the content, we have the pump, we have the pipes, and here we're trying to fill this bottle of water, which is basically our systemic perfusion. But we're not able to fill this bottle of water, and these could be the following causes of shock. There's not enough water in the tank, which means we are talking of hypovolemia. Second, there could be some form of problem with the pump. Either the pump is not functioning internally because it is spoiled, or probably something is jamming the pump and it's not able to push the water from the tank into the pipes. So we have obstructive shock and we have cardiogenic shock. The fourth one can be that there's something wrong with the pipes. Everybody knows that in summers the pipes expand. If the pipes expand, the pipes tend to hold more water than it originally used to. If that is going to hold more water, then we are not going to get any water, or we're going to get less water through the tap into the bottle. So here we're going to talk about distributive shock. So by putting these three components into a simple example, we've understood what happens. If there's a problem with the vessels, we going to end up getting a distributive shock. If there's a problem with the pump, we're going to get a cardiogenic shock or an obstructive shock. And if there is not enough water in the tank, we're going to get hypovolemic shock. Now, hypovolemic shock also can be of different types. You can get hypovolemic shock in a medical case. You can get hypovolemic shock in a trauma case. Now, say you are excessively dehydrated because you've been constantly vomiting and you're having diarrhea. So, excessive dehydration and loss of fluids can cause hypovolemia and eventually shock. Burns. In burns, there's excessive fluid which leaks out from the capillaries. So there's dehydration, there's loss of fluid, and it's going to cause hypovolemia. The third one is in trauma. Now let's go back to our example. Say there was enough water in the tank, the pump worked perfectly, and the pipes were good, but yet we're not able to fill this bottle up completely. Why? Because this bottle has got holes through which water is leaking out externally. This is our external hemorrhage, which we see in trauma. So the three types or the three causes of hypovolemic shock could be excessive dehydration, it could be burns because of fluid loss, and last could be trauma because of external bleeding and hemorrhage. These are the three types of hypovolemic shock. Now, how are you going to treat this patient? You want to keep this patient warm, you're going to cover them with blankets. You're going to make sure that you give them supplemental oxygen, call for ALS backup, and transport them as soon as possible. There's one more thing you can do with these two patients, and probably in a trauma patient depending on the scenario. You could also lift their legs up so that with gravity more fluid is passed or more blood is passed back to the heart into the central circulation. In the next sections we'll talk about the remaining types of shock.